Hey, everybody. Welcome back to the Health Matters podcast. We have a great episode today, recording live from the Las Vegas show floor for Health 2023. Today, we are hosting Murray Brozinsky. He's the Chief Strategy Officer at Amwell. He joined via the acquisition of Conversa Health, now Amwell Automated Care, where he was CEO. Under Murray's leadership, Conversa was honored as Best Remote Diagnostics Company at the Digital Health Hub Foundation Awards, leading AI chatbot for self-triage by CBI Insights, and many other awards. Really excited to have Murray here on the podcast with us. Welcome.
It's all great to be here. Thank you.
Yeah, it's such a pleasure to have you here, Murray. And look, before we dive into some of the questions that we're going to ask you, just for the benefit of the listeners, what is it that inspires your work in healthcare?
Like many people, it was a personal situation that got me into healthcare. I was running a company. It was super exciting. We were taking it public in a completely different space. And my wife was diagnosed with breast cancer. This was years ago. And by the way, she's healthier than I am now. So years later. But I told myself then if I had the opportunity to apply what I was doing, which was technology and applying data to improve people's lives, I would do it in healthcare. And the opportunity arose in 2005. So I had the honor of helping to co-found Healthline, which is now one of the largest health education companies in the world. And from there, I became a serial entrepreneur, helping to build and launch healthcare companies, culminating with the one that's been most fulfilling for me, which has been Conversa, now being part of Amwell.
What a journey, and just great that you were able to take a situation that was challenging for you and your wife and your family and turn it into so much good for the entire industry. Really cool story. At Health, you talked about physician executives, about transformational leadership. How does technology factor into leadership?
You really can't separate technology from business, from leadership. I mean, I think at these conferences in particular, you try to have different tracks. You talk about technology, you talk about clinical, you talk about business. It really loses the power when you separate. So I think technology, especially now with AI, it's part of the fabric of life and the fabric of business. And I think that's the challenge. When you separate it out and the focus and scrutiny is on it, it should fade to the back. It should be considered magic, right? So it's all about experiences. And in healthcare, the biggest problem we've had is it's hard to get patients engaged. We know exactly what patients should do in many cases, and there's a lot of evidence out there. And healthcare is evidence-based. If you follow the evidence, you're likely to get, with high conviction, the outcomes you're looking for. The problem is, how do you get people to engage? And so how do you use technology? And there's a tension, right? So if I told you what you need to do to follow the evidence and we applied that to everybody, that's sort of one size fits all. That would work, but for virtually nobody's going to do that. So how do you use technology to engage patients, meet them where they are, have personalized pathways for them to follow? And so that's the magic of integrating technology into care delivery. And that's, to me, the magic and the thing that's exciting about and how it relates to leadership is how do you bring all those constituencies that are looking at things in a silo together.
And really, it's what I hear you saying is it's making it seamless, right? Invisible, just making it work.
Arthur C. Clarke talked about the best technologies are technologies that are indistinguishable from magic. And we're far from that in healthcare, but that's what we should aspire to be.
That's great. I love that. And speaking of the traditional pillars of healthcare, providers and payers, how will technology transform their business?
Well, providers and payers historically are at odds. And that's been the case. And so there's some fundamental things that need to change in terms of the way the industry works and policy. And again, that needs to work in concert with technology and data. But I think we are at the point now where payers and providers are getting together at forums like this and trying to figure out how we work together in support of our common goals to deliver better care for patients, and how do we spread the risk appropriately. And we talk about value-based care and going at risk. And that's now being applied across the value chain. It's taking some time, but I think there again, technology, payers and providers working together on common platforms, doing more data sharing and partnering really to figure out how to deliver better care ultimately. And it's going to be a rocky road to get there. But what I like to do is I look back, are we better now than we were 5 years ago? And the answer is definitely yes.
Yeah, for sure. And one of the things that keeps popping up is just the single digit margins and being able to make it all work. What advice would you give to some of the providers listening on that front? Like, how do they make it work?
Well, I think providers, if they were sitting here and hearing you just say what you said, would be longing for those halcyon days of single digit margins. Right now, they've been negative for the last probably 24 months. I think this last quarter, they just turned positive on an operating basis, but it's likely to go down again. So the number one issue on provider CEOs' minds has been cost and inflation. And number two are staff shortages. And those things don't go well together, right? I mean, so there's no way out of that dilemma without using technology, right? We don't have the ability, the cost structure doesn't work anymore to support our business, which is care delivery, right? Mm-hmm. And we have a staff shortage in the critical people that are delivering that care. So the only way you can bridge that gap is to invest in technology, but you have to do it in a way that you're getting a positive ROI. So the thing that's changed even over the last 18 months has been all the innovation folks at these hospital systems. Either they don't exist anymore or they've been fully integrated into the operations. And these systems can only make investments in things that work today. You can demonstrate outcomes and you have a fast payback and ROI, typically less than 12 months. So those are kind of the criteria that we see as a partner. And that's changed very quickly. It's changed in the last 18 to 24 months. That's the market change. They're certainly spending and they're investing because they recognize it's existential. And that's why you're seeing consolidation of health systems accelerate. But the only way to get back to the halcyon days of single digit, hopefully higher than that, is to invest in technology. But it needs to augment the care delivery. It needs to be able to leverage because the staff shortage is not a temporal thing. It's systemic. Yeah.
Yeah. No, I love that. Thank you. Thank you for that. That's really great. And it sounds like you and the Amwell team are thinking about this critically and putting together programs and opportunities that do provide that ROI that health systems are looking for. Taking this up one level, does the U.S. need to think about healthcare differently now that it can travel over technology?
Absolutely. I mean, I think it's not just the U.S. I think it's everywhere around the world. I think there's a recognition that, again, it needs to be done in a way. So healthcare it needs to be empathetic, right? It all really is about human relationship. It needs to travel. Roy uses the term, our co-founder, co-CEO uses the term traveling over technology, but it needs to be an extension of the doctor, of the nurse, of the care team. And so what we've tried to do, and I think the best technologies out there, are extending the most trusted relationship in the world in a commercial sense is between a patient and a care team provider. And if you can take that trusted relationship and instantiate it in technology, so it becomes a 24/7 extension of that relationship, which is what we endeavor to do, then I think you're using the best of technology because you're leveraging something that's trusted, something that works, something where there's evidence-based, but you're augmenting it in a way that you can actually deliver the care that the patients and the families need. And so that's happening in the US, it's happening internationally, it's happening across the stakeholders like payer and provider, so they can partner together on common platforms to be able to deliver better care for patients.
You went to the trust component. That is at the core of what drives healthcare, and that you have a tech stack, but at the core of what you're sharing is trust. And that's really exciting to hear from you. From your perspective, Murray, what aren't we doing that we should be doing?
It's not so much what we're not doing, but I'll tell you, so you can't walk around this conference or any conference these days without every conversation being about AI, and in particular, generative AI. So I think, and by the way, I'm very excited about it because I think it's been around a long time. Obviously, it had its zeitgeist moment with ChatGPT in the consumer's mind, but it's been around for a long time. And there's lots of different types of AI. Generative AI, just generating language that's akin to human language, is one piece of it, but being able to use natural language processing to understand what patients are saying, and then being able to predict, so using data to predict what might happen next. And so I'm excited about all of that. I think, and I'm answering the question that you didn't ask, but I think the danger is that we implement it incorrectly and or too quickly, and then we erode the trust. So the whole thing right now is you've got this trusted relationship. Everybody here is developing technologies that should be helping to extend that trust, but it's fragile. If all of a sudden you get out there and we have a couple of missteps, you lose that trust and it'll take years, if not decades, to bring it back. The analogy I like to use is self-driving cars. When there's an accident, right, there's a huge backlash that says we shouldn't do it. Certainly, in many cases, we should never do it, but in a lot of cases, it's not ready for prime time. But the real bar is 1 million people die on the roads in the world each year. So the bar isn't zero. There's one accident, it's being compared to zero. It's compared to 1 million. But there's an enormous amount of education to prepare the public to be able to evaluate it. And we don't have yet that baseline to be able to evaluate AI. That's what scares me.
Yeah, no, for sure. And I think that's a really great analogy, right? The basis for comparison is is zero. And fortunately, that education is needed. And so I really do love that. Look, the work you guys are doing is really making a huge impact for everybody listening today, looking for fresh ideas. What call to action would you give them?
It really is starting with the patient. So healthcare is very, very provider focused. It's very hospital centric. And that's why care is reactive. You wait for patients to come in and you evaluate them. And we're very good at evaluating when you come in, but you come in either once a year for a wellness visit. The only other time you come in is when you've got a problem. So you're already sick. So by definition, the whole system has been reactive. I come to the building, and my doctor assesses me based on my current situation, which may have been brewing for years. And now I'm taking care of someone who's sick. So if you want to flip that and have proactive care that's focused much more on prevention and wellness and everything else, then you need to put the patient at the center. And this has been a hackneyed kind of phrase. People have been talking about that for years. But the only way you can put the patient at the center is if you actually have knowledge of the status of that patient on an ongoing basis. And that requires data. And so that's how we think about it at a very high level. Technologies need to support collecting data from patients earlier and earlier. And for example, in our case, we've got a platform that starts with an integration with the electronic health record. So I have all your information. And then we enroll you in these programs. We provide you with a companion, digital companion, that can check on you. And if we had enough people and we could pay them, we could send people to your house every day, if necessary, every week, if you're sick, and ask you questions and take biometric readings. And right there, that expert can say, wow, you're doing fine, or wow, you're off track. Here's some change in your diet. Here's some exercise plan. By the way, here, you need to actually be on this drug, or you need to come in and see a physician. So we virtualized and automated the ability to do that. But then with data, we can actually go one step further and start to predict based on that situation. We have FEV1 readings from patients that have advanced COPD or have had a lung transplant, for example. We have enough of those readings where we can look at it and say, you might look okay today, but based on other people with those readings, we can predict that your lung function is going to decompensate in a week, or the likelihood of a readmission to the hospital just increase, so we can recommend an earlier intervention. So the whole idea is, how do we pull cost out and use technology to keep people marching down this evidence-based pathway and keeping them healthy earlier on, proactive before it gets bad? But at the same time, how do we identify those people that really do need to come in and see the doctor? And it can be through virtual means, through a virtual telehealth visit, for example, or an in-person visit. And that, if you think about that at a high level, you're optimizing the way that you're delivering care with these limited people resources. So you're getting better outcomes. The patient's having a better experience. The providers are not burning out. They're having a better experience. And then you're back to the single or double digit on the economics, which bends the cost curve. And all those things need to work at concert.
Yeah, no, that's really great call to action there. And the data is another thing to actually get the data where it needs to be for the particular action. And what you're talking about, Murray, is spot on. It's helping really kind of understaffed health systems take action when those exceptions come up that need action, that need intervention. And rather than point of care, you're helping sort of give visibility to how a patient's doing. But if they need an intervention, they come in, right? That's what we're talking about here.
That is exactly right. So you're either waiting for the patient to come in, which doesn't work because then it's too late, it's costly, you're reacting. And to do what you just talked about with people, we just don't have enough resource and cost. So that's exactly where there's lots of uses of technology, but I think that's the highest use of technology is how do you identify the patient that needs help now? And by need, it's weeks, months, years, potentially before things get really bad. So it's a better experience. They're going to have a better outcome, and it saves a ton of downstream medical cost. And then there's a whole bunch of effort with people coming to visits and getting phone calls that are completely unnecessary. So if you knew, hey, this patient's doing totally fine, I don't need to waste this visit or this call, then you would pull not only cost out of the system, but you can redeploy those people so they can practice at the top of their license, really care for patients that actually do need their attention.
Totally. Love that, Murray. Well, very promising. And I really want to thank you for sharing the work that you guys are up to at Amwell and really just some of the thoughts that you have on the matter. If people want to learn more about you or about Amwell, where can they reach out?
So they can reach out to me directly. I actually respond to any communication I get for people that are interested. I'm very passionate about this. Certainly come to our website, and there's lots of ways to contact the right folks at Amwell. But Saul, this has been a pleasure. It's why we do what we do, and I'm super excited to have this conversation with you.
Likewise. And folks, remember, you can find all of the details on today's conversation with Murray Brozinsky in the show notes, including ways to get in touch with him via LinkedIn, ways to get in touch with Amwell and the team over there. Health matters, and the work that you guys are doing, Murray, is helping elevate that. So appreciate all you do.
Really appreciate that, Saul. Thank you.